go over the best ways to use the medicine, whether it be vaporizing, using the concentrates, using the medibles, using any type of suppositories even. You know, you don't think of things like that. You want to get to the area that's most affected. So if someone comes in and they have prostate cancer and they don't want to smoke or they're not used to smoking, why not, you know, tell them about creams and how to make a suppository and get it right to the affected area. These are the things that we talk to our patients about. We have 8 offices in Massachusetts, and in all those offices we see Rhode Island patients as well. So we certify both Rhode Island and Massachusetts patients in all of those offices. We also have an office in Hartford, Connecticut. We have 4 offices in Maine as well. Any patient in any of the medicinal states that has a card can get a visitor's pass to Maine. So if you're going up there on vacation, you are able to go up and use any of the 8 dispensaries that they have up there. Also, there's 1,400 registered caregivers in Maine. It's a phenomenal program up there. Documentation that you have for your condition is definitely helpful to the doctors. By law, it's not necessary. Our doctors can make a diagnosis, but it is definitely helpful. When you come in, you'll register, you'll fill out medical history paperwork, so we know what you have for a condition. As he was saying about the medicines, when we have you fill out the form, we ask you for all the medicines that you're taking. There's a reason for this. We want to know if you're at this level of medicine, okay, so you're taking a narcotic for pain and you're at this level. Well, by now using cannabis, is that level going to decrease over time? Okay, we want to know how this is helping you. We want to have that on paper documented. So 2 years from now, when they're doing all kinds of studies, we can say, look, we have this right here. Our patients are showing time and time again that they start using cannabis, their levels of narcotic use are coming down, you know what I mean, their blood pressure medication, okay? I mean, so it's not just narcotics, things like blood pressure medication. Are you able to come off your blood pressure medication? Are you able to lower it? Cholesterol, things like that. So that's why, as he was saying about, you know, talking to your doctor about what you're on, even telling the doctor, and a lot of the doctors are not educated on it or don't believe in it, as he was talking about with the arthritis study. By going to your doctor and stating, I'm on medical cannabis now, I don't need as much medicine, that's going to make them look at it. All right, maybe one person, they can fluff it off, maybe 2. When a whole community starts coming in to their doctors and they feel confident enough to open up to their doctors and say, hey, I am a medical cannabis patient, this is what I'm using, and look I don't need this much medicine anymore. If you don't tell them and you just start decreasing your medicine, they're gonna think, oh, great. Look at, you know, spontaneously they're decreasing or they're getting better because they're having this medicine. No, there's a reason, and it's not taking the big pharma products. It's by using cannabis that's helping with the conditions that we have. I don't know what else. Does anyone have any questions about anything?
Where's your closest office?
So, our closest office to Rhode Island is Seekonk. Like I said, we do see Rhode Island patients in all of our offices. If for some reason they don't think that you don't have a qualifying condition or you don't have enough information to see the doctor to get you qualified, they usually will tell you right then and there that, well, you know, this might not, for example, in Rhode Island. Rhode Island doesn't accept any psych diagnoses, so you can't have anxiety, you can't have insomnia, depression. In Massachusetts, you can. Massachusetts is very liberal with their conditions. It's basically up to the doctor to determine what condition this is going to help for. In Rhode Island, there is a fixed list of conditions that you have to have one of those to be approved for. Nausea in Rhode Island, severe nausea is one of them. A lot of people who have anxiety also have severe nausea because they're so anxious and it affects them, their stomach, and they have a lot of GI problems because of anxiety. If that's the case, then that would cover you in Rhode Island. Okay, so there's mitigating circumstances. So just because you have severe anxiety and anxiety isn't covered, if you have any other conditions along with that are covered, then you can get your medicinal license. The laws vary in each state as well. In Massachusetts, you're able to have a 60-day supply. You're able to purchase a 60-day supply, and you're able to grow your own. 60-day supply is 10 ounces. So at any given time, you can have 10 ounces on you. In Rhode Island, it's 2.5 ounces every 15 days. So the difference is, if you were to multiply that times the 60 days, it would be the same 10 ounces, but you can only have a 15-day supply at one time. So that's the difference between the two states. You can grow your own here in Rhode Island. Rhode Island's caregivers can have 5 patients. In Massachusetts, you can't. It's one-on-one. There's legislation being put forth right now, going through the courts, the Congress and stuff like that, to expand that to 10 patients per caregiver. So that's something that we'll hopefully see in the future, to expand that. Rhode Island also has 3 dispensaries. Massachusetts just opened their first one. So access to medicine in Massachusetts is not as good as it is here in Rhode Island. Maine has 8 dispensaries, 1,400 registered caregivers. Access to medicine up in Maine is phenomenal. Dorian from Proverti does a lot of testing up in Maine. He has a drop box right outside of our benefit office. So a lot of the caregivers will go and bring their medicine, and even patients, if they're getting medicine from a caregiver, will go and bring it in and have it tested. So I think using the labs is really smart, because you know what's going in your medicine. Some of these things that are floating around, you don't know what's in them. As he was saying, that pen with the peg in it.